Welcome to the Victory Education Lounge. I'm your host, and today we're exploring a fascinating and often overlooked topic: dermatological issues, skin conditions, and insulin resistance. This is part 89 of our ongoing series on metabolic health. Before we dive in, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Did you know that your skin health can indicate your metabolic health? Welcome to part 89 of our series on metabolic health, where we're delving into dermatological issues, skin conditions, and insulin resistance. As you may know, insulin resistance is a state where your body's cells don't respond as effectively to insulin as they should, leading to elevated blood sugar levels. But did you know that this can impact not just your internal health, but your skin as well? Indeed, several skin conditions are directly related to insulin resistance, offering a visible insight into your metabolic health. Today, we'll be exploring the fascinating connection between these skin conditions and insulin resistance, and we'll also be discussing potential solutions, management strategies, and preventive measures. So stay tuned as we peel back the layers on this critical aspect of health. Let's look at some common skin conditions associated with insulin resistance and how to address them. First on our list is acanthosis nigricans. This intriguing condition is characterized by dark, velvety patches that appear on the skin, commonly found in body folds like the neck or armpits. It's a clear sign that your skin is trying to tell you something about your metabolic health, specifically about insulin resistance. Managing acanthosis nigricans requires a two-pronged approach. Firstly, lifestyle changes are needed to improve insulin sensitivity. This can include dietary modifications such as adopting a low-glycemic diet and incorporating regular exercise into your routine. Secondly, topical treatments may be used to improve the appearance of the skin. These could be prescribed by a dermatologist and are designed to lighten the dark patches caused by the condition. The notable advantage of this approach is that addressing the root cause, insulin resistance, can lead to overall health improvements. You're not just treating the skin condition but also improving your metabolic health. However, it's worth noting that these changes may take time to show visible results, so patience is key. To bring this to life, let's consider a real-life example. Meet Sarah. At age 35, Sarah noticed dark patches appearing on her neck. After being diagnosed with insulin resistance, she made significant lifestyle changes. She adopted a low-glycemic diet and started a regular exercise routine. Within 6 months, not only did the patches on her neck lighten significantly, but her insulin sensitivity improved as well. Sarah's case is a testament to the fact that our skin is often a mirror reflecting our internal health. By addressing the root cause of acanthosis nigricans, we can also mitigate other health risks associated with insulin resistance, such as type 2 diabetes. As we can see, addressing the root cause can lead to overall health improvements. The journey to better health is a marathon, not a sprint. And every small step we take towards improving our insulin sensitivity can have a positive impact on our skin and overall well-being. Next, we have skin tags. These small, soft skin growths, also known as acrocordons, often appear in areas where the skin folds like the neck, armpits, or groin. While they're harmless and typically painless, they can become irritated from rubbing against clothing or jewelry. Skin tags are often associated with insulin resistance and can indicate a potential risk for developing type 2 diabetes or metabolic syndrome. The good news is, skin tags themselves can be easily removed by a dermatologist through simple procedures such as freezing, burning, or snipping. However, it's crucial to remember that removing skin tags only addresses the symptom, not the underlying cause. To prevent new skin tags from forming, it's important to address the insulin resistance at the heart of the issue. This can be achieved through lifestyle changes like adopting a balanced diet low in processed foods and high in fiber, regular physical activity, and maintaining a healthy body weight. There are pros and cons to this approach. On the plus side, not only can these changes prevent skin tags from recurring, they can also lead to overall improvements in health and well-being and potentially reverse insulin resistance. On the downside, these changes require commitment and time, and visible results may not be immediate. Let's illustrate this with a real-life example. Meet John, a 42-year-old man who had numerous skin tags. After having them removed by a dermatologist multiple times, he grew frustrated as they kept returning. His doctor suggested that he might have insulin resistance and recommended dietary changes and regular exercise. John took this advice to heart, and after a year of consistent effort, he noticed that new skin tags stopped forming. His energy levels improved, and his doctor confirmed that his insulin sensitivity had significantly increased. So, while skin tags may seem like a minor annoyance, they can be a sign of underlying metabolic issues. If you're dealing with skin tags, it could be worth exploring whether insulin resistance might be a contributing factor. Remember, addressing underlying insulin resistance is key to preventing recurrence. Now let's talk about psoriasis. This autoimmune condition is characterized by an accelerated turnover of skin cells, leading to the formation of scaly, itchy patches on the skin. It's a chronic condition, meaning it's long-lasting and can be managed but not cured. Psoriasis can be particularly challenging to live with, as it's not only physically uncomfortable, but can also have emotional and psychological impacts due to its visible nature. But here's the silver lining. Just like the other conditions we've discussed, managing underlying insulin resistance can improve psoriasis symptoms. So, how can we manage it? Firstly, topical treatments such as creams and ointments can soothe the skin and reduce inflammation. Systemic medications, which affect the entire body, can also be used for more severe cases, but remember, these treatments mainly address the symptoms. To tackle the root cause, lifestyle changes can be crucial. A balanced diet, regular exercise, and stress management can help improve insulin sensitivity and in turn, alleviate psoriasis symptoms. The pros of this approach: it can manage symptoms effectively while improving your overall health. The cons: it may require ongoing treatment and patience, as improvements can take time to show. Let's consider a real-life example. Meet Lisa, who's 38. She struggled with psoriasis for years, finding little relief in various treatments. But when she was diagnosed with insulin resistance, she decided to combine her psoriasis treatment with lifestyle changes. She adopted a low-inflammatory diet, rich in fruits, vegetables, lean proteins, and healthy fats. She also started a regular exercise routine and made efforts to manage her stress levels. Within just 3 months, Lisa saw a 60% improvement in her psoriasis symptoms. Not only did her skin health improve, but she also felt more energetic and healthier overall. So what's the takeaway here? Psoriasis can be a tough condition to manage, but addressing underlying insulin resistance can make a significant difference. Combining psoriasis treatment with lifestyle changes can yield significant improvements. Our next condition is acne. A common skin condition, acne is often associated with hormonal changes during adolescence, but it can affect individuals of all ages. Interestingly, acne can also be exacerbated by insulin resistance. When insulin levels are consistently high, it can stimulate the production of skin oils and contribute to the clogging of follicles, leading to the formation of pimples. While not life-threatening, acne can be distressing and can significantly impact one's quality of life and self-esteem. Managing acne effectively often requires a multifaceted approach. Topical treatments, such as benzoyl peroxide and retinoids, can help control acne by reducing inflammation and unclogging pores. In severe cases, oral medications such as antibiotics or isotretinoin may be prescribed. However, addressing the underlying insulin resistance can also play a significant role in managing acne. This involves dietary changes aimed at reducing insulin spikes. Consuming a diet rich in whole foods and low in processed, high glycemic foods can help improve insulin sensitivity and subsequently alleviate acne. The advantages of this approach are twofold. Not only can it improve skin appearance, but it can also enhance overall metabolic health. But it's important to remember that this approach may require patience and consistent effort. Visible improvements may take a few months to appear. Consider the case of Mike, a 28-year-old who battled adult acne for years. After discovering his insulin resistance, he decided to make dietary changes. He cut out high glycemic foods such as white bread and sugary drinks, and incorporated more whole foods into his diet, like fruits, vegetables, and lean proteins. Within 4 months, his acne cleared by 70%, and he also reported feeling more energetic and healthier overall. This example goes to show that while managing acne can be challenging, it's certainly not impossible. By addressing the root cause, in this case insulin resistance, we can not only improve our skin health but our overall health as well. Patience and consistent effort are key when dealing with acne. Finally, we have hirsutism. This condition is characterized by excessive hair growth in women, often on the face, chest, or back. It's usually a result of hormonal imbalances, which can be linked to insulin resistance. Managing hirsutism typically involves a combination of hair removal methods, medications to address hormonal imbalances, and lifestyle changes to improve insulin sensitivity. The benefits of these strategies can be twofold. Not only can they improve the appearance of the skin, but they can also help rectify the hormonal imbalances that contribute to the condition. However, it's important to remember that results may take time and consistent effort. Let's consider the case of Anna, a 30-year-old woman who battled with hirsutism. After being diagnosed with insulin resistance, she started a low glycemic diet and regular exercise routine, in addition to using prescribed medication. Over the course of a year, Anna saw a significant reduction in excessive hair growth. Remember, while skin issues can be frustrating, they often serve as important indicators of our internal health. By addressing insulin resistance, you're not just improving your skin, you're enhancing your overall well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their health journey. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions should be discussed with a licensed physician or qualified healthcare professional.